My name is Kelly Hall, and I am the CEO of Inheret. Inheret was created with a $2.6 million NIH grant. We fully kicked off our commercial launch in January of this year, and I'm excited to share all that's happened since then. 60 million Americans are thought to be at risk for developing cancer due to their genetics, and only about 10% of them have ever been tested. Of those who have been tested, 65% had already had cancer, leaving only 35% tested in time to do something about it. Our goal is to reach the remaining 90% before they have a diagnosis. So why are they not being identified? It isn't because providers don't care, especially with malpractice claims on the rise when they fail to identify these high-risk patients. Paper forms make it near impossible to interpret information against the complex guidelines during a brief and problem-focused primary care visit. And patients don't provide a detailed family history while sitting in the waiting room. The solution is technology, a patient-facing tool for documenting the information, think Ancestry for health information, a provider-facing tool that does all of the analysis and flags for risk, allowing the provider to spend their time with the patient in a more comprehensive conversation. There's also documentation that risk was addressed, mitigating the possibility of a malpractice claim later on. This is an example of the Inheret difference. One family member can mean the difference between average risk and high risk for a rare mutation. It's no wonder providers need help. Here's how it works. The provider sends an email or text to the patient asking them to begin their health diary. When the patient is done, they show up in a work list for the provider where the guidelines and risk models have already been calculated. If the patient meets testing criteria, there's an easy button for the lab, which saves the provider time filling out additional forms or re-entering information. And when desired, we can push all the results over to the EHR. We have a lot of traction. Thanks to our grant, we've been able to publish outcomes data in the Journal of NCCN and a poster at ASCO. 2 U of M clinics converted from grant to paying customers, and we're working on expansions into new locations. We are live with 1 clinic at Steward Health in Massachusetts and are expanding into oncology, breast surgery, and breast imaging. We're in contracting with Pikeville in Kentucky, and we are live with Ambry and in process with Myriad. Our pipeline is robust, each customer segment represented from employers, payers, health system, and labs. Our business model has 3 customer segments: healthcare providers, where in SaaS model form, they pay a subscription fee. Employers and payers follow a per member fee structure, and our laboratory partners pay a fee every time a provider uses their easy button. Each customer segment has a unique marketing target. There are 300,000 primary care, internal medicine, and oncology providers who would have an annual subscription fee of $1,200. I've been focusing here due to my connections, and we use ZoomInfo to obtain contact information for outreach. Laboratories are incented to gain market share and pay a transaction fee when the provider submits an order. The self-insured employer segment covers an estimated 105 million lives. We're having discussions, and a focus of investment dollars will be to partner with Aon Endpoint to obtain immediate access to the benefit brokers. We've been busy over the past 5 years with our grant work and finding a lead investor at Accelerate Blue. Since the beginning of the year, we met our health equity goals with smartphone access and additional languages and gained sales traction. The remainder of 2023 will be focused on sales and meeting 500,000 ARR, as well as closing our funding round. Future goals include expanding into cardiology and pharmacogenomics and growing our strategic partnerships. We stack up well against the competition. We're not limited to one customer segment. We are more comprehensive in both the guidelines we offer and the inclusion of cancer screening and prevention. Our leadership team has experience in startups, genomics, laboratories, and investments. I have over 20 years as a cancer center administrator and 10 years in business development with health systems and genetics. As you can see, 2024 begins to see rapid growth in revenue due to the additional resources to be funded by the investment. Our gross margin is strong due to limited variable costs and results in a solid ROI for your investment. We're raising $2 million to fund the sales initiatives and product enhancements that will result in a higher ACV through a combination of outsourcing and team development. The exit opportunity is with our targeted strategic partnerships, labs, health plans, and even EHRs. I look forward to the opportunity to share more about Inheret.